welcome to our Safety Week. And we're very excited today to introduce Dr. Chau. And I'm Mary Jane Cambria, and I am the chair of the Orange County Realtors Education Committee. Dr. Chau is the director of the Orange County Health Care Agency and acting county health officer. He was previously the chief clinical and strategy officer for Mind OC, the nonprofit entity that supports Be Well OC, a coordinated system to improve Orange County's mental health services. We're honored to have him today. And if you have any questions for Dr. Chau, please put them in the Q&A. And when he's done, as time allows, he will answer your questions. And so I'll turn it over to you now, Dr. Chau.
Thank you so much, Mary Jane, and thank you for the invitation opportunity to speak to you folks. And believe it or not, I've been wondering on, gosh, how do you guys manage this and do your job in a safe way? So I'm excited to share information with you. One point of correction, I'm actually the county health officer, not acting. I've been in this role since June of last year, so it's over a year. No worry. I don't know. I know some. I believe it's Cal Optima board director where I sit, that they have my bio as still acting. So we need to fix that. People pointed out to me, so you might have gotten my bio from Cal Optima. I don't know, but anyway, it's a great opportunity to talk to you. So. Before we started, you've asked me to talk about which guidance you should follow and what have you. Maybe let me start by explaining how these guidance come out from the federal to the state, etc., so we have a better understanding. Okay, so I, as a county health officer, is actually under the authority of the State Department of Public Health, as well as the CDC, the Center for Disease Control and Prevention. And so overall in our country, there's about 4,000 health officers that are under the authority of the CDC via the State Department of Public Health. So our California has a state health officer appointed by the governor and the legislatures. And then that department work in conjunction with 62 health officer in California, because California has 58 states and 4 cities that have appointed health officer. So I am the appointed health officer for Orange County. So usually the CDC will make recommendation or guidance, then that come down to the state, and then the state will mix its own guidance, right? So it could be more restrictive than the CDC, but it cannot be less restrictive than the CDC. So as you know, there are several lawsuits from several states where the governors go against the CDC guidance. And as you probably heard, most of the lawsuit, the governors of those states lost, because from a public health perspective, the public health department of the state has to follow and be more restrictive than less restrictive from the CDC guidance, okay? So whatever the state create the guidance is for that state, at the local level, the county health officer can be more restrictive, but cannot be less restrictive than the state guidance. So that's where the differences lies. I'll give you an example. LA County decided to mandate that everybody indoor, regardless of whether or not you're vaccinated or not, you have to wear a mask. Okay, while Orange County and majority of other county, not majority, I shouldn't say, about half of the county, but majority of the larger counties, we say for individuals who are not vaccinated, there's a mandate for you to wear a mask indoor. But if you are fully vaccinated, we only strongly recommend that you wear a mask. And in Orange County, We talk to people who are fully vaccinated and advise them strongly to wear masks if they are at risk or they live with individuals who are at risk. And I'm going to get more into that. Okay. So in Orange County, just like LA County, we can be more restrictive, but we cannot be less restrictive than the state guidance. I want to make it clear that people understand that piece. Okay. So where we are today, I'm happy to share that for those realtors who live in Orange County and work in Orange County or work in Orange County, whatever that combination is, our number continue to improve, and I'm very pleased. If you look at all our case per 100K, case rate per 100K, I think we are the best among all the large Southern California counties. And if you want the exact number, you're welcome to go onto our website. We update that number every day during the weekday, and the website is Orange County OChealthinfo.com, and then you look for coronavirus or COVID-19, and it will take you to an entire website with all kind of information. So as of today, our case rate per 100 is 11.4, and then our positivity rate is at 4.3. So that's very good number, because a month ago we were at much higher number than that. The number of hospitalization also has dropped dramatically, as well as the number of people who were in the ICU. We were at high 400 to 500 a day in terms of the number of people who are in the hospital because of COVID. We're now at 370. And then we were at like 150 or so or more in terms of number of people who are in the ICU because of COVID. We're now at 100. And then our ICU bed capacity is at 22.3%. And you probably have heard that recently central counties in the state were in trouble because of their ICU bed availability dropped dramatically. And so the piece that you want to follow is, do we have the ICU bed capacity to take care of folks? Because that's the most important, right? ICU bed, intensive care units are units that take care of people who are most severe. And then you also want to know where your case rate is, okay? Some people might say, but LA County have a lower positivity rate. You got to understand on how that calculated, because LA County has many entities that mandate testing. Therefore, they have a lot more people who get tested for screening than Orange County. And so when you guys know this, you guys do best with math. So when the denominator is huge, it drives the percentage down. So that's how. So I've always asked people to pay attention to the case rate per 100K, because that is independent of how many tests you conduct, right? And so that is the number for you to gauge. And so Tehran just texted me that the other website that you can go to look at all of our matrix is COVIDvaccinefacts.com. So that's another site for you to come in. And so that is the front of the COVID issue in Orange County. I was very nervous and continue to be looking at what are the numbers, because we are almost 2 weeks out from the Labor Day weekend. As you know, anytime you have a large holiday, you're looking at an increase in cases. And so far, I even got a report today that our cases is running about 300 per day. And that's what it gave us the case rate at about 10 or so per 100K. And so I'm very comfortable with that. I'm waiting to see what the number would be over the weekend. So if we cruise through this weekend with low case number, then we are very, very good. Because usually 10 to 14 days after a large event, that's where you see people showing up with symptoms, and then they went and they get tested, and then they get tested positive, right? And so I think we are pretty much over 90% out of the wood. But again, I have to wait to see what our number would be for this weekend. If we are coming into next week with low number, then a very good chance that we was not very affected by the Labor Day weekend. And I think we might not see a huge surge from the Labor Day weekend, just because as time goes on, more people go in to get vaccinated. So we're a bit more protective. The other thing too, and you guys would probably appreciate that, right? People always said, wow, the difference in terms of the number of people who are fully vaccinated in Orange County or any other county for that matter, compared to LA is only like 3 to 4%. But I have to remind you is 3 or 4% of 3 million people is very different from 3 or 4% of 10 million people. So you appreciate that, right? So you can't look at the percentage. Again, you got to look at the bucket, right? So if the bucket is larger, that 3 or 4% means a whole lot more people, right? And so when you have a whole lot more people, the risk is higher. So that's how these metric get into place and how you look at it how you should look at it that way. So that's on COVID. So it's tied into this because I've always been curious because I know the real estate market is just booming. And I also worry about a realtor who go in and show, houses and what have you, is that, gosh, I hope that they know the right thing to protect themselves. And so I would say in general, because you're showing homes indoor, that even if you are fully vaccinated, let me preface it by saying that if you're fully vaccinated, of course, the state guidance is that if you're not vaccinated, anybody who's not vaccinated, when you're indoor, not in your own home, you have to wear a mask, right? That's the mandate. But even if you're fully vaccinated, because you're showing your house to the public, unless you require them to show proof of vaccination, I would recommend that you wear a mask yourself, especially if you are somebody who are at risk. At risk meaning you have chronic health conditions, you are receiving chemotherapy treatment, or you have a condition that lower your immune system, right, protection, or if you live with somebody who like that, or if you live with somebody who are not eligible for the vaccine yet, or for one reason or another have not been vaccinated, you really need to protect you to protect them. And so I would recommend that wear a mask, right? And so because you're allowing folks to come in close contact with you, because I know each home showing is probably longer than 15 minutes, and you have to get close to them to create that relationship, that you probably put yourself at risk if you don't wear a mask, because you don't actually know whether or not the people who come to view the home have been vaccinated or not. I mean, they could lie and tell you, yeah, I'm vaccinated. We know that happened. We do know that there are people who are faking even the CDC white card that's showing that they've been vaccinated, and we're cracking that down. The federal government cracking that down, but there are. I mean, it's amazing on how people would go at length to do things like that, right? And so please protect yourself and please protect your loved one. Okay, so that would be my guidance as is related to a real estate doing your work, showing the homes, and then how do you protect yourself. So let me get into the mental health. I want to address it three things. So first is the myth around people with mental illness. And I know some of you might say, well, I'm going to show a home, and what if the owner or whoever lived there is acting differently? So the myth is that people with mental illness are violent. That is not true whatsoever. It is not true. There's been study looking over and over again and looking at the number of people who commit violent crimes and whether or not it is a largely or a significant number of them are individuals with mental illness, and that is not true. In fact, the number of people who commit violent crime with mental illness is really small. I don't have the exact number for you, but I want to tell you that that is the biggest myth, okay? Then the other piece is people with mental illness are difficult to work with. That is not true as well. I mean, some of the people that I know, my patient who have mental illness is the nicest and kindest people that I know. I think what would set off somebody with mental illness is that when they feel threatened, right? When the public stigmatize them or do things that put them in a corner, just like anybody, it would make them become defensive and they might be a bit more aggressive. But I think anyone could be like that if you are pushed into a corner by someone. You don't need to have a mental illness to react that way, right? And so I want to make sure that we understand that myth. And then let's talk about mental illness in the workplace. I think that it is I believe that you guys are probably a very, very stressed profession, because of the market when it's not good, or even if you think you can close a deal that would give you a large income, and then people might change their mind, you probably feel upset about that, because you can't predict whether or not you can close the deal until somebody signed a dotted line, right? And so that kind of volatile condition could put people who are stressful, especially under this environment of the pandemic this last 20 months. And so be aware of that. You're not alone. Other people are the same way. I mean, imagine if you work for a restaurant and then one day they open and the next day they close. I mean, we hear a lot of people who are very stressed out of that. And I think because of that when we reopen this time, a lot of folks hesitant to come back to work because they don't want to get into that yo-yo, because if they get on their unemployment benefit, then they go back to work, shut that down, then the next minute the business closed again, they have to reapply for an unemployment benefit. That process is very cumbersome, and so I think that's probably a really huge reason into why a lot of businesses cannot hire people back on time, because people just don't have that reassurance that the economy will remain opening if we have another surge. So I think that I'm very confident that we won't see another surge as big as this time or in the winter, specifically the winter, because as the number of people who are getting vaccinated grows, the pocket of folks who are infected in terms of not fully vaccinated will shrink, right? I can tell you that this last surge, a month ago until now that we're recovering, the majority of people who tested positive, and the majority, over 96% of those who get admitted to the hospital, were individuals who are unvaccinated. So you need to know that there have been people who are fully vaccinated who were hospitalized, but they were hospitalized because they have really chronic health condition or their immune system were low, that the Delta variant got into them, right? And that's why you've seen most recently there was a guidance for people with lower immune system to get a third dose of the vaccine. That's the reason, because we've seen people who fully vaccinated with those chronic health conditions were testing positive. They don't necessarily end up in the hospital. Many of them, that's why I gave you the 96% of folks in the hospital are unvaccinated. The remaining 4% are people who I just mentioned, who fully vaccinated with chronic health condition. But even when they're in the hospital, their condition very mild. They didn't need to be in the ICU and what have you, okay? And so I think as the number of people who get vaccinated grow, the risk for us to get into a surge will shrink. And so that's the good thing. I do worry though about the mental health condition, because there will be among you will be those who are probably not vaccinated or live with individual or have family and friend that are not vaccinated for one reason or the other, and you probably be frustrated and what have you. I just think that I would ask for you to, in your business environment, support each other emotionally. I don't know, and forgive me, I don't know. I think most of you have health insurance, and part of the health insurance package is the employee assistance program. Utilize that. If you need help with mental health, don't worry to reach out for help. Orange County, we have a number to help you to access mental health services. Is OC Link, and I'm waiting for Toronto to text me with the number for OC Link. But if you know anyone, or if yourself feeling suicidal, please call the National Suicide Lifeline, and that is 800-273-TALK. 800-273-TALK. And the other myth is that if you have a friend or a family who talk of suicide, the myth is, oh, if you ask them about it, they're actually going to carry it out. That is absolutely false. It's not true. That is the biggest myth, whatsoever. So if you're suspecting somebody who feel depressed, severely depressed, and have thought of suicide, you need to ask that person, because when you ask that person directly, you're giving that person the permission to talk it out, right? Give them the number. Don't feel like a burden. You don't need to be a therapist. You just need to ensure that they're safe, and then give them the information to call. The National Suicide Hotline is the number one number that I think you should be giving to folks. And so Toronto just text me, if you need resources in Orange County for mental health services, call 855-OC-LINKS or 855-625-4657. Let me repeat that number again. To ask for resources for mental health, call 855-OC-LINKS or 855-625-4657, okay? There are people there 24/7, and they will advise you based on your insurance or no insurance, refer you to treatment for mental health treatment. So I think that's very, very important, right? And so support your colleagues, support your family, especially those who have suicidal thought, to really talk to the professional, call a professional, and seek help. There's no shame in seeking help whatsoever, okay? And then the other thing is for prevention. I think it would be really important for you all to, for a business, right, individual business, to create opportunity for all the realtors, for everyone who work in your business, to come together, chat with each other, check in with each other, and talk about mental health, support each other, right? And do healthy activity, mindfulness practices, do walk in the park together, do activity together to support each other. But most importantly is understanding that you all are not alone, and that there are help out there. I always say that prevention works, treatment is very effective, and recovery is very possible. So please understand that. So prevention is when you destigmatize mental illness and talk about it openly and support each other. That is so, so important. So let me end there and see if we have any question. Mary Jane, am I missing anything?
There are a few questions, and thank you so much. You clarified so many things for us, but there are a few questions for you.
Great.
One is, can you please talk about the latest MU variant?
Oh, the Mu variant, yes. So the Mu variant was discovered out of Peru. And since then, now it has spread to about 41 countries in the world. And if you look at the percentage of tests, when you do the genetic testing of all the positive test. Peru I think, is about 40% of their cases are mu variant. There's some indication that the mu variant escaped the vaccine, but remember, the vaccine available in each country are very different, right? So we have now over 4,000 cases of mu variants in the US. And then we have about 2,000 cases in California, and locally in Orange County, about a week ago, we have 14 cases. But so far, it didn't look like it has any concern. So WHO, the World Health Organization, about 2 to 3 weeks ago, listed mu variant as a variant of interest. So there's two levels of paying attention to the variants. And first, if there are some high number of variant that identify a certain characteristic, then the WHO would list it as variants of interest. And then if it vamping or the cases is increasing worldwide, then they'll move it into variants of concern. So the Delta is an example of a variant that moved from nothing to interest to concern, okay? The US, though, however, has not even listed mu into variants of interest, because when the CDC looked at it, it doesn't look like the mu variants in California, in the US, has escaped the vaccine. In other words, people who have been fully vaccinated have been protected from the mu variant. That's it, okay?
Thank you. Okay, another question is, does the double masking make a difference?
So here's always been my advice, okay? I concern with double masking is that people would constantly juggle the two masks to make sure that it fit well. I think you are better off in wearing a single mask, double layers, that would fit well. And remember, wearing a mask that fit well is it cover above the ridge of your nose and covers your chin, right? So that's that's a proper way of wearing your mask. So if you wear a mask, one single mask properly, versus somebody who wearing two masks and then kept moving and kept having to use the hand to touch the face and mix that, I would say no, don't do the two masks. That's too risky because you're playing around with your face and your mask a lot, and you might contaminate your hand, and you need to wash your hand frequently. A single mask, double layer, would be okay. Now, a gaiter is not a double layer mask. I wanted to let you know that, right? There's people who wear gaiters. There are people who pull their t-shirt to cover the nose. A bandana is not a proper mask. A mask has to be a double layers, okay?
Oh, thank you very much. Okay, and one other question is 96% of hospitalized people in OC, or is that USA?
OC.
It's OC.
In the US, it's the same figure as well.
Okay, thank you. Is there any other questions anyone wants to put in the Q&A? Otherwise, Dr. Chau is a very busy man. Oh, wait, we do have one. Let's see. No, I don't think there's any more questions. I think you've pretty well covered everything. I'm so appreciative of you. Oh, wait, here we go. What does the county do with the information regarding outbreaks?
Okay, so I have been beaten up by the media these last 18 months. How come Orange County doesn't list outbreaks? Okay, so let me explain this. How it works is that by regulation, Cal OSHA regulation, any business entity that have 3 positive cases in your business place in the last 14 days, you're supposed to call the local public health department and inform us that, hey, Dr. Chau, we got 3 cases. Or in our scrubbing of the data every day, if we notice that there are 3 people who positive within the last 14 days, and when we do case investigation, we found out, they all 3 work at the same McDonald's in the same corner, then we will call the business and say, hey, you might possibly have an outbreak. An outbreak is defined as 3 people who tested positive, but they give it to each other at the workplace. So if you got 3, especially when there's high transmission in the community, if you got 3 people who independently get infected in the community or at home because they're out doing their thing, and just because they test positive and they work in the same place, it does not mean that it is an outbreak. Does that make sense? So you have to give it each other. We have to be able to investigate the individual and say, hey, is there any chance that you got it from the outside or you got it at the workplace? When we interview all 3 people, and if there's no chance for them to get it from the outside, that's how we define that they are epidemiologically linked, and therefore you have an outbreak. Does that make sense? And that scenario, what happened the most is when the transmission of the virus in the community is really low, and then you just happen to have 3 people in the same business that tested positive. You kind of question, well, the chance of them getting in the community is probably very low. They most likely will get it in themselves, right? And so the reason why I have not been posting outbreak on my website so the media can feed into it is because it takes time to interview individual and then be notified and interview them to figure out whether or not they linked. So by the time we have the outcome, the result, whether it's outbreak or not, 10 to 14 days has passed. But that is the link for that is the amount of time for isolation. So what's the point of posting an outbreak? Especially when you have high transmission, right? Everybody should be aware, knowing your risk, and do the right thing. If I say, oh, for realtor in Orange County, the corner of 17th Street in Bristol, there's an outbreak there, what is that going to do? Nothing. And it's inevitably stigmatize your business and make people have this false sense that, oh, I shouldn't go there because they have people giving each other the virus there. In fact, when it's not true, right? Majority of the county in California do not post cases of outbreak. I mean, I know some county do post the outbreak, but even they said, we kind of do it haphazardly, and then we don't have the resources to take them down because to do it properly, you have to post it, and then when the time is done, you're supposed to take it down, right? I don't have the human resources to do so, and I don't think it's necessary at this point when you have high transmission, because the public should be careful anywhere you go, not just at certain business. And I don't want to stigmatize the business and call them out as an outbreak place and cause them to be stigmatized and cause people to go to the next business, might not be an outbreak, but probably have more risk because they're not doing the right thing, So that's explaining why I don't ever post outbreak.
Thank you. That's pretty clear. We have 2 more questions, and then we're going to let you go. How long can the COVID virus stay alive on paper or books?
That myth has been start from the beginning, and there are people who are looking at that, and what we know that, on surface is probably a couple hours and that's it, right? And that whole, in the beginning, remember, if you have a case, they tell you to clean every nook and crannies and turn your business office upside down and spray. That's no longer the recommendation. You just do your cleaning every night like you do. You should be okay. And so,
thank you. That's good news. Okay, and the last one then is, those that have had COVID, are they immune?
So that's a great question. I'm so glad whoever
asked
that question. It was you. Okay. So you probably heard that a couple of weeks ago, there was some peer review article that some group of researcher was going to publish from Israel, and then it caused concern. And that article said, oh, people who have been previously infected have the stronger immunity. That is absolutely not true, okay? People who previously been infected, you are only protected within the first 90 days after your infection, okay? That's the reason why we recommend that even if you are infected in the past, you need to get the vaccine. Okay, there are some people who go out and say, oh, I can measure my antibody and that will tell me how strong my immunity. No, there's no need for you to measure the antibody in your system because it doesn't tell you how strong it is. It is the a type of immune cell that called memory T cell, memory B cell. That's the type of cell that you need to measure to ensure that someone has strong immune system. But that kind of test is very expensive and it's very painful to do. We don't recommend it. And so for those of you who hear rumor that, oh, you need to go, even if you vaccinated, you need to go measure your antibody level and that will tell you how strong the immunity is. That is a scam at this point. So don't waste your money. Don't do it. It's expensive. Nobody recommend it. Okay. So in other words, if you get infected 90 days after the infection, that's where your immune is pretty active and you're safe. Believe it or not, we have seen people who get even reinfected by a different strain, and we do know that, like up until day 90 after their infection. And so that's why the CDC strongly recommend that if you've been infected, get your vaccine. And actually, people who've been infected get the vaccine. Those are the folks who have the strongest immune system than anybody else. So,
well, Dr. Chau, this has been so informative. We thank you so very much. And we can let you go if you need to get going. And I want to just say a few words to our audience. And before we wrap, I just want to remind everyone that one attendee today will win a safety-related prize following this webinar. And if you attend all 5 webinars, you'll be entered in the grand prize drawing for a Simply Safe Security System Essentials Package. So we have one more session today at 2 p.m. with Orange County District Attorney Todd Spitzer and Deputy District Attorney Kate Wagner as they provide an update and share information on real estate fraud. So tune in later and don't miss it. And thank you for joining us today. And again, thank you, Dr. Chau.
Thank you for what you do. Mary Jane, it looks like there was another question about booster shot. Do you have time for me to respond
yes,
to that?
we have time.
Yeah,
We have time.
yeah, so you probably heard about the booster shot and the 3rd dose, right? Let me make it very clear. If you receive press release from Orange County Healthcare Agency on a weekly basis, the press release from last week, we clarify what a booster shot is, right? And so the company that make the vaccine are working on a true booster shot, meaning a different amount of vaccine, and it could be a different, slightly altered vaccine from the original vaccine that you got. So those are booster shot. A 3rd dose is the exact amount and the exact vaccine that you've got from the previous 2 shots. Okay, so 3rd dose means an extra dose of the original generation of vaccine. Let me use that term. Okay, so if you got the Moderna community now that or Pfizer vaccine, then the 3rd dose is the exact same shot that you've gotten the last 2 times. The booster shot is a different, slightly changed vaccine configuration that are a bit more protective on the future variants, and then the dosage might be different. The CDC has not decided, and the FDA have not decided to authorize a 3rd shot or even the booster shot for individual outside of that population that I talked about earlier. If you are immunosuppressed, if you have chronic health condition that suppress your immunity, or if you're currently receiving cancer treatment, the FDA have not recommended for anyone outside of that group to get a 3rd dose. Okay, so I don't know. I heard that the CDC, the FDA will be reviewing data tomorrow, Friday, to make a decision on whether or not the FDA would recommend a third dose for everybody else based on whether or not you've gotten your second dose 8 or 6 months ago. Okay, so that has not been determined. But remember, the FDA authorized it, the CDC also have to authorize it, and then the ACIP, the Advisory Committee on Immunization Program, also have to authorize it. And then it will come to the state, and then the state will also have to decide whether or not the state would recommend it. And that's how people would get vaccinated. So I've heard that tomorrow, maybe the FDA would consider authorizing for the general population and decide is it 6 months or 8 months. You probably have heard that the WHO has came out with an official announcement, strongly discourage rich country, I know they're targeting the US, is to not offer the third dose because the majority of other countries in the world have been suffering from shortage of vaccine. And so everywhere in the world, people are still struggling with high number of people having COVID and die just because their country do not have the resources to get the vaccine there. I mean, it's a heartbreaking story that in the African continent, most of the country in Africa, their vaccination rate is 1-2%. 1-2%. I mean, even in Asia, some of the country like Vietnam and Thailand, hardest hit. Indonesia, hardest hit this last surge, where thousands of people die every day. I mean, their vaccination rate is what, 10%, 15%. And so WHO said, please, rich country, US, UK, and France, please be mindful that the rest of the world are still struggling with the vaccine, that don't move into the third. Now, I mean, a lot of people have very different opinion about that. From a public health perspective, I believe that globally people are transient and moving around, and I agree with WHO that we need to make sure that there's equity in vaccination globally because we're a global citizen. And so I know some people disagree with it, including my relatives, but from a public health perspective, that's what that is. And so be on the lookout, more will come, especially in California, because of the recall election result. There'll probably be more guidance coming next week. Okay.
Thank you. I
Thank
guess
you
we have
again.
another question here. Wait a second.
Oh, okay.
Does COVID virus cause any heart-related issues? And really, this is the last question.
So great question. You probably have heard that the COVID vaccine caused some myocarditis in young, specifically young white male, right? So you've heard about that. But when you look at the number of heart-related issue from the vaccine versus heart-related issue from the COVID virus, coronavirus, the number of people with heart condition inflammation due to COVID is way higher, much, much higher. And in fact, there's been people who die from heart condition failure because of COVID. I've not heard of anybody who died from heart inflammation due to the vaccine. So again, please get to the source, the real source for information. Go to the CDC website, go to the state website, go to our website, and if you don't trust the government, go to the American Association of Pediatric website, go to the American Medical Association website, the medical professional website, give you true evidence, to data, to science. Okay, don't Google.
Well, I guess I didn't tell the truth because we have one more question here.
Okay.
We have time, so I don't want to miss it. It's since I hear
Sure.
folks speaking about the vaccinations coming for young children, Why would we need to do this when children don't seem to be affected?
Okay, great question. The information out there that children are not affected by COVID is a lie. Let me repeat that. Children are not immune from COVID. In Orange County, we have over 30,000 kids who tested positive for COVID. Currently at Chalk Hospital, there are yesterday, I should say, there are about 7 kids in the hospital due to COVID. They're young, very young, okay? And 3 of them are in the ICU, okay? And all of them came from family where the adults are not vaccinated. Let me repeat that. All the kids who are hospitalized at Chalk, and in fact, up until now, most if not all the kids who was hospitalized came from family where the adults are not vaccinated. We just had a second death of a kid here in Orange County in August, and this kid is under the age of 5. I cannot give you any more detail than that because the family has not consent for us to share that story. Now, some people might say, well, that's only 2 kids. For me, that is 2 kids too many for us, because those are precious young lives that have not seen and experienced the community, the society, and the family, and we lost them. We have also known that there are kids who infected with COVID and developed severe immune system condition called known as MIS, multi-system inflammatory condition syndrome, okay, from COVID. We now know that at least a quarter of the kid who recover from COVID continue to have cognitive inability to help them study. And worse than that, we do know that there are kids who develop psychotic symptoms from COVID. And about a month ago, there was the very first case in Orange County where the parents had a 14-year-old son with COVID. Family has no history of mental illness whatsoever, and the kid developed psychotic symptoms because of COVID. So you tell me whether or not COVID affects children. You make that decision, okay? The number might not be as high as the adults, but can you imagine you are the parent of that child who have COVID, and worse than that, a child who's going to struggle with their studying because of COVID, or worse than that, a child who develops psychotic symptoms of COVID, and the ultimate worst is that that child died from COVID. Mm. I get upset when I hear people say, oh, it doesn't affect our children. It does affect our children. So I'm sorry, wow. I'm very emotional and passionate about that.
Well, it's very heartbreaking to hear, and it's a message that needs to be shouted to the rooftops.
Yes.
Thank you, Dr. Chau. This has been such an enlightening presentation.
Thank you. Yeah. Please help me if you have friends or family that have children or have high vulnerable, high risk people that they live with and they care about, and if they have not been vaccinated, they really need to get vaccinated. I confidently say this. I've said this from the beginning, and I still say this. The world, the US, and California and Orange County cannot get out of this pandemic without people get vaccinated. No other choice. We have no alternative.
Great message. Thank you so very much.
Thank you for what you do. Thank you.
Thank you, and have a wonderful day. And thank everyone. Thank you for joining us today. And remember, this is recorded, so it's something I want to watch again. So Dr. Chau, again, thank you. Have a wonderful day.
Thanks, Mary Jane. Thank you, everyone. Bye-bye.